Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to discuss 2 questions about masks. The first question is whether masks are safe to use, especially in patients with COPD. There have been concerns in the past that masks can cause lung issues, such as a decrease in oxygen delivery and an increase in carbon dioxide, which then leads to dizziness and fainting, especially in persons with lung disease such as COPD, because these patients already have compromised oxygen exchange. A study recently published in the American Thoracic Society Journal on October 2nd attempted to answer this question. I'll put a link in the description so you can read the study. In the study, researchers took 15 healthy residents working in the hospital and 15 veterans with severe COPD. They placed a surgical mask on all of them and tested their oxygenation and carbon dioxide exchanges at baseline, and then after a 6-minute walk test, and again 30 minutes later. They found no significant difference in either group in the amount of oxygen and carbon dioxide exchange. Their conclusions were that any sense of problems with wearing a surgical mask could be due to the neurological sensations on the face from the heat generated by the mask, or breathing in warm air, or the psychological impact of the mask itself, which can sometimes induce claustrophobia, anxiety, or perceived difficulty in breathing. The second question that I often get asked is, do I need to wear a mask outside, especially when I exercise? Let's remember that the formula for successful infection is exposure multiplied by time, and also whether the space is enclosed or open, and what sort of ventilation is happening in that space. A preprint study that's not been peer-reviewed studied effective rebreathed volume, or ERBV, to try to shed some light on this. The higher the ERBV, the assumed higher risk for infection. I'll put a link in the description for this study so you can review it as well and give your comments and feedback. One limitation of this study is that we don't know at what ERBV number for a particular particle size guarantees a SARS-CoV-2 infection. And even to this day, we're still not sure what size particles and at what amount will cause a COVID-19 infection. But we can assume that the more particles you inhale, the higher your risk for infection will be. So for the sake of this chart, higher numbers indicate a higher risk for infection. In this chart, they looked at 1 micrometer particles, and they compared indoor and outdoor interactions over 15 minutes, 1 hour, and 4 hours. We can see that outdoor interactions overall had much lower ERBV levels than anything inside, but the ERBV numbers did increase while even outside, although they still remain small, the longer you were outside with someone at a close distance. However, when you look at the indoor ERBV numbers, you can clearly see how much bigger the numbers are and how much bigger they get when you're in a small space at close distance for a longer period of time. Well, of course, these results make sense. This is what we've been seeing and hearing all along. But let's get back to the question about wearing a mask outside. Overall, being outside in general is always going to be safer, and adding a mask while being outside lowers that risk even further. But I want to give reassurance that this study showed that you need to be in very close proximity to someone for quite some time, at least more than 15 minutes, before your ERBV number gets high enough to warrant concern, at least in my opinion. But as I mentioned before, we don't really know at what ERBV level you're guaranteed to get an infection. So if you're exercising outside and you're not going to be in close proximity to someone for more than a few seconds, then I don't see the need to wear a mask. But if you're outside at a protest and in close proximity to people for a period of time, then I would definitely recommend wearing a mask. But once again, realize that your risk will likely never be as high as if you were doing that same activity indoors in a confined space. Thanks again for joining me.